live. Okay. Okay. Chalo. Good evening. Very good evening to all of you, student. I hope I am clearly visible and audible at your end. So, all of you, welcome to LRR Physiology. आखिरी कोशिश, last resort revision, right? So, in physiology, what we are going to discuss? We are going to discuss only those important things which you must have to revise before your exam, right? Those things we are going to discuss in this LRR session. Yes, multiple chat are coming up. How many? Okay, PY will be discovered. Good evening, good evening, good evening. Okay. So, so what is the plan? Plan is that first of all, I will be discussing few one-liner, important one-liner, and all those one-liner are basically based on your PIQ. So, most of the PIQ will be covered in those single liner or one-liner important question. Okay. Next, we will be discussing few important images which are frequently asked in your FMGE examination, right? And then I will be discussing few mathematical problems, like very few mathematical problem has been given in your FMGE exam for the last couple of years. So, those mathematical problem we will be discussing, and at the end I will show you few tables, important tables which you should memorize for your exam. That is the plan for today, right? We are not going to discuss and go for an MCQ and their answer, not in that fashion. We are going to discuss in a step by step fashion. So, first of all, we are going to discuss what? We are going to discuss the important one liner, right? Okay. Right. Okay. So, CNS easier beneficial for NEET. So, basically for NEET we had taken another session, or there will be more session for the NEET. So, this is typically for FMG examination. Okay. But as you know, nowadays the division between FMG question and NEET PG questions are very less. So, this will be beneficial, but this is typically targeted for FMG examination, as you can show here it is mentioned. Okay. So, now without taking much of the time, we are going to discuss the important one liner for FMG exam. Okay. So, the first one is a surfactant is secreted by, all of you know the answer of this question. So, type 2 pneumocyte. Okay. Type 2 pneumocyte is the answer of this question. Second, receptor mediated stretch reflex and inverse stretch reflex, दोनों का आंसर बताओ. What is the answer of these two things? Okay. So, stretch reflex and inverse stretch reflex, very very important. So, stretch reflex is which one? Is the muscle spindle. Okay. Muscle spindle is the receptor for stretch reflex, and inverse stretch reflex is the Golgi tendon organ. Bare minimum thing that you have to remember about these two receptors is that muscle spindle is located within the main muscle bulk or main muscle belly, and the stimulus for muscle spindle is increase in length of the muscle or change in velocity of the muscle. Both are important for your upcoming MCQ. So, if I ask you what is the stimulus for, okay, yes, what is the stimulus for muscle spindle? Your first answer will be increased length, and second is the increased velocity or change in velocity. Both can stimulate muscle spindle. The second one is the Golgi tendon organ. If I ask you what is the stimulus for Golgi tendon organ, your answer will be if there is increase in tension at muscle tendon, then that is the stimulus for Golgi tendon organ. So, these two important is very very important for your MCQ. These two important line you have to remember. Okay. Next one, resting membrane potential of nerve fiber is close to isoelectric potential, or multiple times in every sessions I discuss this line. So, there are two similar type of question. In one of the question the statement is close to isoelectric potential, and in other one it is the equal to isoelectric potential. So, whenever it is close to, your answer is always potassium equilibrium potential. You may say that potassium equilibrium potential is minus 90 sir, and RMP of the nerve fiber is minus 70 sir. How it is close to? Question is close to means they are asking that RMP is mainly close to which ion equilibrium potential, and the answer is the most permeable ion through cell membrane. So, the most permeable ion through the cell membrane is potassium. So, that is why answer of the close to question is always potassium. But whenever it is equal to, now I have to go that RMP of the nerve fiber is minus 70, equilibrium potential of which ion is minus 70, the chloride. Similarly, if I change the same question, this question, suppose I have changed this question rather than this nerve fiber, if I change this question for myocardium, then the equal to myocardium, the answer will be again potassium, because potassium has an equilibrium potential of minus 90 millivolt and the myocardium also has an RMP of minus 90 millivolt. So, all of you are getting this concept that whenever the question is about close to equilibrium potential, close to isoelectric potential of which ion, always answer is potassium, whether it is nerve fiber, whether it is myocardium, whether it is smooth, whether it is cardiac muscle, anything, right. But whenever the question is equal to, then you have to look at which tissue they are asking about. It is nerve fiber, so chloride. If it is myocardium, then answer is again potassium. So, this two important statement is very important for your upcoming MCQ. Remember this, okay. Next question. Single important line, hormone regulate blood level of 125 dihydroxy. It should be 125 dihydroxy, not hydroxy. 125 dihydroxycholecalciferol positively means they are asking that which hormone increases the level of 125 dihydroxycholecalciferol, which is also known as calcitriol. ये आपका MCQ आया था already. So, calcitriol, which hormone positively regulate the calcitriol formation or activation of the vitamin D3, that is your parathyroid hormone, because we all know that parathyroid hormone stimulate the 1-alpha hydroxylase enzyme which is present in the proximal tubules of the nephron. Proximal tubule, that also have to remember that if I ask you PTH has action for the conversion of the inactive to active form of vitamin D3 in which part of the nephron, your answer will be proximal tubule, okay. That additionally you should remember. Then the best stimulus for the release of vasopressin. Now, here you have to remember that the MCQ that has been asked in your question, the best stimulus for the release of the vasopressin, if this is the question, what will be your answer? Could you tell me? Your MCQ was different, in that the option was not there. So, best stimulus for release of the vasopressin or ADH is increase osmolality of blood, increase osmolality of blood or increase in sodium ion concentration of the blood. Very good. But the MCQ that has been asked in your exam, then increase osmolality was not there. Then the second thing you have to remember that any cause of hypotension or hypovolemia or decrease blood volume is also a stimulus for ADH secretion, because this hypotension or decreased blood volume will stimulate the production of angiotensin II, and this angiotensin II is a stimulus for vasopressin release or ADH release, okay. So, hypotension or hypovolemia, very important, okay. So, please remember that the most important stimulus for ADH secretion is increased osmolality. If that is not there in the option, then you go for the hypotension or hypovolemia, because both of them are the stimulus for the angiotensin II. Apart from that, you also should remember that severe pain in the body or severe nausea can also stimulate the secretion of ADH. So, these are the additional stimulus that you have to remember. You may get a question where options will not be there, like osmolality, hypotension will not be there in the option. Then you can choose that increased severe pain or severe nausea is also a stimulus for secretion of ADH or vasopressin. Got it? Okay. So, this is important for your future MCQ. Next one. Electrical impulse in the heart originate from, so obviously all of you know the answer, SA node is the answer. Then the next one, inhibin is secreted by, this is a very important thing which you have to remember. So, inhibin is secreted by, what will be the answer? SA node छोड़ो, वो तो हो गया, वो तो सबको पता है. So, inhibin is secreted by, okay. So, in case of male and in case of female. Okay. So, obviously, in case of male mean, and you have to remember one cell in testis which is going to produce this inhibin, that is Sertoli cell. Very good, Sertoli cell. And in case of female, it is the granulosa cell. Okay. Granulosa cell is the main answer. Granulosa cell is the main answer because in the proliferative phase, it is the granulosa cell which is the main secretory cells for inhibin B particularly. And corpus luteum is also an answer, but corpus luteum obviously it is going to secrete inhibin in the secretory phase of the menstrual cycle, and in that condition inhibin A is produced mainly, not the inhibin B, and the main inhibin is inhibin B. So, inhibin B is the main one. For male, it is the Sertoli cell which produce the inhibin B, okay, and in case of female, the main cell which produce the inhibin B is the granulosa cell during the proliferative phase of the menstrual cycle. In secretory phase, corpus luteum also produces inhibin, but that is mainly inhibin A, right, that you have to remember. Later on there is another question on the inhibin. So, this is very, very important for your future MCQ. Try to remember the secretory cell first, okay. Next, center controlling vomiting. So, you have to remember the center is typically known as the CTZ, chemoreceptor trigger zone, which is also known as the area prostrema. Okay. So, this area prostrema was the answer which was there in your MCQ. So, there is an MCQ there, this CTZ was not in the option, chemoreceptor trigger zone was not in the option, but the option that was given in the question was the area prostrema. So, you have to remember that CTZ is also known as the area prostrema, and that is the vomiting center. Very good. Next one, the cardiac event at the end of isovolemic relaxation. At the end of isovolemic relaxation. So, end of isovolemic relaxation means ventricle is fully relaxed. So, it is ready for taking blood from atrium. It is ready for filling. So, for filling of blood inside the ventricle, what you require? You have to open up the atrioventricular valve. So, opening of AV valves, okay, opening of AV, atrioventricular valves is the answer. It can be mitral valves opening or it can be tricuspid valve opening. Getting my point? So, opening of the AV valve is the answer, cardiac event at the end of isovolemic relaxation. Okay. Similarly, cardiac event at the end of isometric contraction or isovolumetric contraction. So, isovolumetric contraction or isometric contraction, whatever, same. So, whenever the heart is contracting isometrically, isovolumetrically means all the valves are closed and the heart is contracting. So, it is a phase of systole, but all the valves are closed. So, why the heart is contracting but all the valves are closed? Because it is generating pressure. That pressure will be, that pressure should be sufficient to open up the valves which is present at the level of the arch of aorta and at the level of pulmonary artery. That means, isovolemic contraction, the phase has what is the importance? Importance of this phase is that it is the heart is generating pressure to open up the valves. Which valves? The semilunar valves. So, at the end of the isovolemic contraction, there will be opening up of semilunar valve, semilunar valves. Okay, semilunar valve means it can be aortic valves or it can be pulmonary valves. Okay, so this thing you have to remember. Both the question has been given already in your previous year MCQ. Okay. Now, next to renin is secreted by and erythropoietin is secreted by. Okay. So, renin is secreted by, it is a direct straightforward question. What cell? Yes. So, JG cell, okay, juxtaglomerular cell, which is also known as the granular cell of the kidney. Okay. Okay. So, this is the cell which is secreting the renin, which is also known as what cell I told you? It is also known as the granular cell of kidney. It contains the renin containing granules, and that because of that renin containing granule, the cell is also known as the granular cell. So, the JG cells, where it is located? If I ask you JG cell where it is located, your answer will be it is at the level of the below. Where the JG cell is located? Where the JG cell is located? My question, answer karo. So, JG cell or granular cell. Okay. DCT, that is the macula densa का आंसर, वो भी DCT नहीं है, DCT is not the answer, uppermost part of the thick ascending limb of loop of Henle and DCT junction is the macula densa, but DCT is not the question. Yes, so JG cells are the modified smooth muscle cells of afferent arterioles. So you have to remember what is JG cell, it is the modified smooth muscle cells, it is the modified smooth muscle. So smooth muscle, where it will be located? Obviously in the arterioles, okay. So afferent or efferent arteriole? Afferent arteriole. So modified smooth muscles of afferent arterioles are the answer of this, okay. Modified smooth muscle cells of afferent arteriole are the answer of JG cells, okay. So please remember this important information. Now what is the stimulus for secretion of the renin? Renin secretion, what is the stimulus? Okay, देखते हैं answer. What will be an answer if I ask you what is the stimulus for renin secretion? Okay, number one stimulus, most important stimulus if I ask you. Very good, okay. Lowering of the blood pressure is the most important stimulus. Hypovolemia can also be there, but hypovolemia in turn will causes hypotension, and hypotension is the direct stimulus for secretion of the renin, decrease blood pressure, right. Apart from that, you also have to remember sympathetic stimulation via beta 1 receptor is also a stimulus for renin. Apart from that, PGE2, prostaglandin E2 and PGI2, इसको भी remember करो, PGE2 and PGI2 are also the stimulus for the secretion of the renin. Apart from that, adenosine, ATP, angiotensin, they are also stimulus for the renin secretion. But anyway, at least you have to remember this sympathetic system stimulation, decrease blood pressure, and your PGE2 and PGI2, right. Okay. Now coming to the erythropoietin secretion. So some of you are answering that liver and kidney, fair enough. But the question is, which cells in the kidney secrete erythropoietin? That is the answer question. So erythropoietin is secreted by which cells of kidney? So you have to remember that we generally say that this is the, yes, very good, peritubular, okay, peritubular capillaries जो होता है उसके चार पास में peritubular capillaries cells, epithelium cells of kidney, epithelium cell, okay. Peritubular capillary epithelium cells are the sources of erythropoietin in kidney, and in liver it is the perivenous hepatocyte, which is also known as the ETO cell, okay. But the main source of erythropoietin is kidney peritubular capillary epithelium cells, okay. But you know ki if you Google it, the research article is also saying that recently another cell has been discovered, which is known as the NORN, Norn cell. What is that Norn cell? It is a kind of stromal cell in the kidney, stromal cell in the kidney, and now it has been proven that it is the NORN, Norn cell, or the stromal cell in the kidney, which is the main source of erythropoietin. But we have to remember both, because you don't know that whether the examiner is up to date with this information or not, okay. Most of the cases this node cell has not been written in any of the books so far, it is in the research article so far, right. So you have to remember that peritubular capillary epithelium cells are the main source of erythropoietin, but recently it has been discovered that is stromal cell of kidney, which is specially named as node cell, NORN, node cell, that is the main source of erythropoietin. Now if I ask you, what is the main stimulus for erythropoietin secretion? What is the main source or stimulus for erythropoietin secretion? Like for example, I told you what is the main stimulus for renin. Now question is, what is the main stimulus for erythropoietin secretion? So now here your answer is direct, that is hypoxia is the main stimulus for secretion of erythropoietin, and that's why we know if you ascend into high altitude, erythropoietin secretion increases, and that causes your increase in number of RBC count, increase in hemoglobin count, which is known as the physiological polycythemia, that is in high altitude, okay. So hypoxia is the main stimulus for erythropoietin secretion from kidney. Got it, okay. Chalo. Next question. Which structure connect the Broca area to Wernicke area? We all know the answer of this question, that is arcuate fasciculus. Arcuate fasciculus, no further discussion here, okay. You know something about that. But now come to the next question, which part of the thalamus is related to motor control? So please look at the question, they are specifically asking about the which part of the thalamic nucleus, which thalamic nuclei is responsible for motor control. So, thalamus is making loop with the cerebral cortex. So, from the cerebral cortex to thalamus and from thalamus to cerebral cortex, there are multiple loops in between the basal ganglia and cerebellum are there. And which part of the thalamic nucleus is responsible for that? The ventro-anterior and ventrolateral nucleus of thalamus. So, this VA and VL, ventrolateral and ventro-anterior, these are the two nucleus which is making a loop with cerebral cortex, basal ganglia, cerebellum and thalamus, and it is responsible for motor control of thalamus. So, thalamus is also responsible for motor control through this basal ganglia and cerebellum. If I ask you that basal ganglia connected with which nucleus of thalamus, cerebellum is connected with which nucleus of thalamus, your answer will be same, that is a ventro-anterior and ventrolateral. Now, if the question is which thalamic nuclei is mainly responsible for sensory control, the meaning of the question is that from the periphery, all the sensory ascending tracts like the dorsal column or anterolateral spinothalamic tract, they are the sensory tract. All of those tracts will reach at to the level of the thalamus. Which nucleus of thalamus? Ventro-posterior lateral and ventro-posterior medial. Ventro-posterior. Ventero-posterior lateral VPL and VPM. These are the two nucleus where all the ascending tracts, the dorsal column as well as the anterolateral spinothalamic tract will reach first the thalamus and from there it will reach to the cerebral cortex. So, which nucleus of thalamus is responsible for that sensory function? Your answer is VPL, ventero-posterolateral and ventero-posterior medial. Okay. So, at least you remember these two important information or thalamic nucleus for your future MCQ. Okay. So, this is important. Okay. Next, resistance against passive stretch. So, this was the MCQ which was asked in your previous year question. Resistance against passive stretch is called. So, answer of this question will be, this is known as the muscle tone. Okay. So, this is known as the muscle tone. What is that? So, suppose this is the biceps muscle. If you contract this muscle voluntarily, then the muscle is generating some strength, muscle strength. The muscle is generating some muscle strength because I am voluntarily contracting it. This is known as the active contraction of the biceps muscle. When the muscle is contracting actively, it is generating some strength. That strength is known as power of the muscle. That strength is known as the power of the muscle. So, answer of this question is power, right. So, if the question is asking specifically that the active force generated by the muscles, active force generated by the muscle against resistance. Okay. So, you are giving some resistance like this and I am contracting the muscle against that resistance. So, muscle is contracting actively, it is producing some strength. What is the name of that strength? That strength is known as the muscle power. Okay. So, power means muscle is actively contracting, but whenever the word is used, the passive stretch means biceps ka what is the mechanism of action is the flexion of this thing. But if you do the opposite action, so whenever you are stretching your arm like this, biceps is not doing that. Okay. So, you are stretching it, in that condition biceps is relaxed. So, during the even the relaxation condition also, muscle contains some resistance. This resistance which is passively there inside the muscle, not because of active contraction, that resistance is known as the tone of the muscle. Getting my point? So, you have to remember that whenever this word is used, passive resistance inside the muscle, that is tone. Whenever the word is used, active force generated in the muscles against the resistance, then that is known as the power of the muscle. Tone and power is checked in case of neurological examination. So, this can be given in your future MCQ. So, try to remember them. Okay. Next is that reward center in the brain. Okay. So, I have written some of the information because this question can be given not only reward center, the punishment center can also be given. So, reward center means there is a part of the brain, if that part of the brain is stimulated, so you will feel that you are getting some reward, you are getting some benefit, you are getting some feel good sensation. That center is known as a reward center. The experiment has been done on animal and scientists found out that the main reward center is the brain is area which is located near to the medial forebrain bundle. So, first information that you have to remember is where the reward center is located close to the medial forebrain bundle. This is the exact line from Guyton. located along the course of the medial forebrain bundle. And this question has already been asked in NEET entrance examination, where options was medial forebrain bundle. But in your exam, the question which has been asked, their medial forebrain bundle was not in the options. But look at here, near to this medial forebrain bundle, what are the important areas which are located and they are part of the reward center of the brain is the ventral tegmental area and the nucleus accumbens. They are the main reward center which is located close to the medial forebrain bundle. Okay. Apart from that, the other area are also there, like amygdala is also part of the reward center, hypothalamus is also part of the reward center, but at least 3 names you have to remember. Medial forebrain bundle, it can also be given as a separate option, so that is the answer. But if that is not given, then the ventral tegmental area and nucleus accumbens, at least you remember these 3 things, okay, for your MCQ. Now, punishment center means if you stimulate this center, then your feeling will not be good. Your feeling will be, you will be very, very angry because it is the sensation like that of a kind of punishment, right. So, this area where it is located, the punishment center is located central gray area surrounding the aqueduct of Sylvius. We call this area as periaqueductal gray matter region. So, periaqueductal gray matter region is the area, if you stimulate this area, the animal will be very, very angry, it will take a defensive posture as if it is going to attack you. So, that kind of posture is obviously the defensive posture, the animal is angry, and that area where you are stimulating and the animal is causing this kind of behavior, that area is known as a punishment center. So, if you if you stimulate this punishment center multiple times, the symptoms that is happening in the animal is known as a rage reaction. So, the question can also be given that which center is known as the rage center, okay, angry, okay. So, the animal is getting angry, the animal is taking a defensive posture as if it is going to attack you. So, which center? That is same, the punishment center. If you stimulate the punishment center again and again, the animal will show some behavior, and those behavior are known as the rage center. Not only that, in human also the same is there, the periaqueductal gray matter is the center for punishment, and if you stimulate this center again and again, the rage reaction will be produced, okay. Same, along with that, you have to remember that periventricular zone of hypothalamus and thalamus also contain certain amount of rage reaction or punishment center, but the main is the periaqueductal gray matter is the punishment center, okay. You have to remember this, okay. Okay, obviously aqueduct of Sylvius means जहाँ पे होगा. Now next question is active form of vitamin D3. We have already discussed, that is 125 dihydroxy cholecalciferol. Okay, cholecalciferol, and that is calcitriol. Calcitriol. Got it? Okay. So everybody, I believe you will be able to answer this question. Okay, so we are not taking much of the time. Next question: in case of small stimulus causing more pain, look at these 2 terms which I have written here, hyperalgesia and allodynia. Which is the answer? What is the answer of this question? A small stimulus causing more pain. What is the answer between these 2 terms? So, I have written the meaning of these 2 terms. Hyperalgesia. Hyperalgesia means kya, and allodynia. What is the meaning? Okay. So, allodynia means if I give a non-painful stimulus, you have to look at this statement. Sensation is a sensation of pain in response to normally innocuous stimulus. What is the meaning of innocuous stimulus? Innocuous stimulus means non-harmful stimulus, non-pain producing stimulus, non-pain producing stimulus is giving you pain sensation, that is known as allodynia. Getting my point? So, allodynia means non-pain producing stimulus, like suppose I am giving you touch, I am simply touching your body and you are getting pain. That is abnormal, also obviously abnormal. But is the stimulus is supposed to give you pain? Answer is no, because it is a touch. It is going to give you the touch sensation. Rather than touch, you are feeling pain. So, that kind of sensation is known as the allodynia. Okay. Suppose I am giving a little warm stimulus on the surface of your body. Suppose 39 degree centigrade temperature water you are pouring on your surface, 39 degree centigrade temperature. Okay. Sometimes in the winter we take bath with the lukewarm water. So, that is going to give you the sensation of hot, but rather than hot sensation, you are feeling pain sensation all over your body whenever you are pouring lukewarm water. So, what is that? Allodynia. Getting my point? Exact similar kind of statement will be given in the question, that a person is taking bath with lukewarm water and he is feeling severe pain on the body. What is that? Allodynia. Now, what about the hyperalgesia? Hyperalgesia means here the stimulus that you are giving, that stimulus is a noxious stimulus. Noxious stimulus means the stimulus itself is supposed to causing pain. So, it is known as the pain producing stimulus. So, normally if I give this kind of stimulus, this stimulus is a mechanical stimulus. It is going to give you pain sensation, but this pain is not very severe. I can tolerate it. But whenever I am giving this kind of stimulus, a little pain, but you are getting severe pain, then that is known as the hyperalgesia. Getting my point? So, here the question is typically saying the small stimulus causes more pain. What is the answer? Answer is hyperalgesia, not the allodynia. थोड़ा सा भी एग्जैक्टली बहुत पेन हुआ, ओके, बट थोड़ा सा छुआ नहीं, थोड़ा सा पेन दिया तो ज़्यादा पेन प्रोड्यूस होगा, छू लिया तो पेन प्रोडक्शन हो रहा है, तो दैट इज एलोडाइनिया, राइट. सो छूने से पेन नहीं होता है ना, बट दैट इज गिविंग पेन, दैट इज एलोडाइनिया. बट थोड़ा सा पेन देने से ज़्यादा लगने लगा उसको, दैट इज बेसिकली योर hyperalgesia. Got it everybody? Okay, right. Now next one is adequate oxygen delivery at cellular level occurs in which type of hypoxia? So you all know that there are 4 types of hypoxia. What are the 4 types? Hypoxic hypoxia, okay. Then second one is the anemic hypoxia, okay. Then third one is the stagnant hypoxia, okay. And fourth one is the histotoxic hypoxia. So in all of these 3 types, there will be decreased delivery of oxygen at the level of tissue. But in the 4th type, the tissue delivery of oxygen will remain normal. But what is the problem of histotoxic hypoxia? The electron transport chain in the mitochondria, which is supposed to utilize your oxygen, that is damaged in case of histotoxic hypoxia. And all of you know that cyanide poisoning is a typical cause of histotoxic hypoxia, where the tissue is damaged, okay, but the supply of oxygen to the tissue is absolutely normal, but tissue is not able to utilize the oxygen, okay. So histotoxic hypoxia, either the cyanide poisoning or vitamin B1 severe deficiency, very, that are the 2 causes of histotoxic hypoxia. In that cases, the tissue will not be able to utilize oxygen, but delivery of oxygen to the tissue is normal, okay. Yes, okay, cyanide is the most potent, okay. So this is the important thing that you have to remember, that answer of this question will be histotoxic hypoxia, okay, right. Next one, normal anion gap, I have already written the answer, 8 to 12, some of the books are saying 8 to 16 milliequivalent or millivolt per liter, that is a normal anion gap. Next question का आंसर बताओ. First vibration sense is mediated by, first vibration. So here you have to remember, if the question is slow vibration, the stimulus is Meissner's, but first vibration, the receptor is Pacinian corpuscles. So Pacinian corpuscle, the best vibration frequency is 200 Hz. So 200 Hz or above, if the frequency is like that, then the best stimulus to pick up that vibration sense is Pacinian corpuscles. But if the frequency of vibration in and around 50 Hz, then that is a slow frequency vibration. In that cases, Meissner corpuscle is the best to pick up that stimulus, okay. So these 2 important information, remember. The major thyroxine binding protein is, all of you know, TBG, thyroid binding globulin, okay. So ये क्वेश्चन का आंसर हो गया. नेक्स्ट क्वेश्चन, corticospinal tract crosses at the level of. So all of you know that the crossing over the corticospinal tract, you know that 80% fiber crosses to the opposite side, that's from the lateral corticospinal tract, and 20% fiber remain uncrossed. This 20% fiber which is remain uncrossed, they form the anterior, okay, corticospinal tract. This important information is required to remember, okay, and it crossing over occurs at the medullary junction, means medulla followed by spinal cord जहाँ पे start हो रहा है, that spino-medullary junction or the lower medulla is the best. Okay, so you have mock up the previous year question, that's why you are giving answer lower medulla. Absolutely correct, lower medulla was in the options. So spinomedullary junction or lower medulla is the answer of this question. But also you remember that how much percentage of fiber crosses to the opposite side, generally 80 to 90% fiber crosses to the opposite side, and that's from the lateral corticospinal tract, and 20% remain uncrossed, that forms the anterior anterior corticospinal tract, right. So this is the important. Okay. Hormone responsible for breast cramp during breastfeeding. So this hormone has been asked multiple times in your MCQs, multiple times in FMGE examination. This is very important hormone for your purpose, that is oxytocin. Very good. Oxytocin is the hormone which is responsible for the milk ejection. Okay, milk ejection reflex. So this hormone which is causing milk ejection, how the milk ejection occurs? Because of the contraction of the myoepithelial cells of the breast tissue, and because of the contraction the oxytocin sometimes produce breast cramp during breastfeeding. So you also have to remember this. Okay, reflex responsible for tachycardia. Oh my god, this question has been asked multiple times in your FMG exam. So you have to remember that this is the question which can be given as an clinical type of question also, direct line question also, but you remember that if there is increased blood volume or if there is distension of the right atrium due to any cause, distension of the right atrium due to any cause. So suppose there is increase in ECA volume, extracellular fluid volume, or there is increase in blood volume. Suppose this is the question they are giving, increase in blood volume, all of them will causes right atrial distension, and whenever there is distension of the right atrium, what is going to happen? The vein bridge reflex is going to be activated. Vein bridge reflex is going to be activated. So answer of this question will be vein bridge reflexes. Okay, vein bridge reflexes will be the answer. Okay, so brain bridge reflex may sometimes you have certain confusion. What will happen to blood pressure? Brain bridge reflex is not about blood pressure, it is only going to increase your heart rate. If there is increase in heart rate, there will be change in blood pressure subsequently, but that is not part, blood pressure change is not part of the brain bridge reflex. Brain bridge reflex is only increase in heart rate. But compared to the other reflex, if you compare the Bejol-Jeris reflex or Cushing reflex, there the heart rate will also change as well as the blood pressure will also change. I believe you remember the Bejol-Jeris reflex means there will be severe bradycardia, severe hypotension along with apnea, that is the Bejol-Jeris reflex. And Cushing reflex means there will be hypertension along with bradycardia. Getting my point? So you parallelly you have to remember these two reflexes. What are those two reflexes? Bejol-Jeris reflex. Bejol-Jeris reflex means there will be decreased blood pressure, decreased heart rate, there will be apnea, and there will be vasodilation. Okay, and in case of Cushing's reflex, okay, so in case of Cushing reflex there will be increase in blood pressure, but there will be decrease in heart rate, along with that there will be irregular respiration. So these two important reflex you also have to remember along with vein bridge reflex. Okay, yes, increase in stretch of the right atrium, that will produce, yes, very good. Okay, good. Next question. As filtrate flow through the PCT, the concentration of all of the following decreases. So we all know that most of the ions, absorption of the most of the ions occurs in the proximal convoluted tubules. Okay, but one ions is not that much absorbed in the first part of the proximal tubule, and that is chloride ion. Why? Because sodium and chloride, okay, they should be reabsorbed parallelly, but that does not happen in the proximal tubule because sodium reabsorb along with the amino acid, along with the phosphate, along with the bicarbonate in the proximal part of the tubules, and chloride is not reabsorbed along with sodium. That is why chloride remains, okay, reabsorbed. Chloride remain unabsorbed in the proximal part of the tubules, and because of which there will be increase in concentration of the chloride in the lower part, I mean later part of the proximal tubule, and based on this question has been asked that as the filtrate flows through the PCT, the concentration of all of the following decreases except, your answer will be chloride ion. Got it? Okay. Next, insulin act on glucose metabolism by. So, I believe all of you can answer this question. So, insulin act on glucose metabolism by stimulating which GLUT? GLUT4. Okay. This is a must know information, and GLUT4 means which kind of process this is? This is the facilitated diffusion. Do not forget about this, facilitated diffusion. GLUT means that is a facilitated diffusion. Okay. And where the GLUT4 is located, I believe all of you know that the muscles, okay, skeletal muscles and your cardiac muscle and your fat tissue. Okay. So, muscles and fat tissue, they are the main site where the GLUT4 is located. So, I believe facilitated diffusion and GLUT4 you must have to remember. Okay. Now, skeletal muscle and adipose tissue, next question. So, which GLUT it is going to contain? So, this is a GLUT4. Okay. Now, the third one, affinity of carbon monoxide to hemoglobin in comparison to oxygen. How many times or how many times? This is 200 to 250 times. Some of the books are saying 260 also, but this is 200 to 250. Generally, most of the Indian textbook has given 250 times. So, but some of the books are also saying 200. So, 200 to 250 is good enough to remember. Okay. Now, mechanism of action of ANP. So, ANP, atrial natriuretic peptide. Okay. So, previously we discussed that whenever there is stretch of the right atrium, which reflex will be activated? Brain bridge reflex. Along with the activation of the brain bridge reflex, if there is stretching of the right atrium, the atrial natriuretic peptide increased secretion will also be there. Means what is the stimulus for secretion of ANP from right atrium muscles? Increased stretch on right atrium. So, whenever there is increased stretch on right atrium, brain bridge reflex will be activated. Parallelly, atrial natriuretic peptide secretion will be increased from the atrial myocyte. Now, this atrial natriuretic peptide, how it is going to act? It is going to act through second messenger system, and that second messenger system is the question here, that is the CGMP. So, please remember, two hormone act through CGMP. One is ANP act through the CGMP and the nitric oxide. At least you have to remember that these two hormone act through the cyclic guanosine monophosphate activity, and that is ANP and nitric oxide. At least you remember these two hormone. Okay, I will show you one table where all this hormone has been given, but at least you remember ANP and nitric oxide. Okay. Next, center for body temperature regulation. The main center for body temperature regulation, all of you know, that is the hypothalamus. But more difficult questions will be asked from the same topic, that if they are asking that shivering center is which part of the hypothalamus. Suppose this is the question, shivering center is located in which part of the hypothalamus? Anterior, tuberal, posterior part of the hypothalamus. So, what will be your answer? So, please remember, this is an important one. Answer batao. Anterior hypothalamus and posterior nucleus of hypothalamus. Anterior nucleus of hypothalamus, all the response which is happening in hot environment, hot response is by anterior hypothalamus, and all the responses in the body which happens whenever you are exposed in cold environment, that is done by posterior nucleus of hypothalamus. So, whenever I am saying that shivering center, so shivering will happen whenever you exposed to cold environment, right? Right. So, which nucleus of hypothalamus is controlling that? Posterior nucleus. So, that is why we say that posterior nucleus of hypothalamus is also known as a shivering center. But whenever I say, yes, you have written sweating, sweating is executed by which nucleus of hypothalamus? So, whenever you expose to hot environment, there will be vasodilation, there will be sweating. Okay. So, all these things are executed by anterior nucleus of hypothalamus. So, hypothalamus is the main center for thermoregulation, and you remember anterior for hot response and posterior for cold response. Okay, that is all. Okay. Next, site of action of piloerection can also happen, okay, in response to cold, that is also there. Okay. So, shivering will be there, curling of the body and piloerection will also happen. Site of action of L-type calcium channel in skeletal muscle. So, whether it is skeletal muscle or the cardiac muscle the L-type calcium channel is also known as the DHPR type of calcium channel, dihydropyridine receptor type of calcium channel. Where they are located? They are located on the T tubules. Okay. T tubules, they are located on the T tubules. Parallelly, you also have to remember that there is another calcium channel that is known as the RYR type of channel, ryanodine receptor channel. And where these ryanodine receptor channel are located? They are located on the sarcoplasmic reticulum. Sarcoplasmic reticulum is also known as the L tubules, longitudinal tubules. Okay. So, please remember L type calcium channel. What is the meaning of this L? Here the meaning of L is long type. This type of calcium channel remain open for long duration. That's why they are known as the long type calcium channel. Okay. And this L type calcium channel is also known as the DHP or dihydropyridine receptor type of calcium channel. Where they are located? They are located on the transverse tubules or the T tubules of the skeletal muscle and cardiac muscle membrane. Okay. And RYR, ryanodine receptor channel, it is present on the sarcoplasmic reticulum membrane. Sarcoplasmic reticulum is also known as the longitudinal tubule or L tubules of skeletal and cardiac muscle. Why I am saying skeletal and cardiac muscle again and again, not the smooth muscle? In smooth muscle, the T tubule is absent. Okay, T tubule is absent. Okay, and L tubule, which is the sarcoplasmic reticulum is also rudimentary in case of smooth muscle. That's why I have not taken the name of smooth muscle here. I am only saying cardiac and skeletal muscle, same kind of feature is there. Got it? Everybody try to remember this. Okay. Now, next one, thyroid hormone act through which kind of receptor? This is a very famous question, but it is an easier question, nuclear receptor. The receptor of thyroid hormone is directly located at the level of the nucleus, intranuclear receptor. Okay, obviously intercellular to hoga hi hoga, but internuclear. Now, next question, in the JVP waveform, the A wave correspond to in the jugular venous pressure waveform, the A wave correspond to. So, A wave means that is equal to atrium contraction. Very good, atrium contraction. But there are multiple questions from this JVP and A wave. So, I will show you one image, okay, because I have kept some important images for you. There I will show you that this A wave in JVP is corresponding with which heart sound, or C wave correspond with which heart sound, that has been given in a separate image based diagram. Okay. So, I will show you that. Okay. Next one. A patient presented with high blood volume accompanied by a decreased heart rate, which is most likely physiological mechanism responsible for this kind of response. High blood volume, okay, tell me the answer. High blood volume accompanied by a decreased heart rate. What is the most likely physiological mechanism responsible for this? Is a vague kind of question, but could you answer this? Yes. So, this is typically Cushing, but here they see high blood volume is not the actual thing. This is the high blood pressure should be there, because in Cushing, you know that Cushing reflex, the high blood pressure is because of increase in intracranial tension. That increase in intracranial tension will produce a response which is known as the CNS ischemic response, modified form of CNS, and that will increase the blood pressure. So, that should be actually increased blood pressure with decreased heart rate. With decreased heart rate, then the answer will be Cushing reflex. Cushing reflex. But if the question is high blood volume accompanied by a decrease in heart rate, so you have to look at what options they are giving. Some of you are saying the baroreceptor, chemoreceptor, that can also be answered. So, whenever we know that suppose there is increase in blood volume, So, what will happen? Secondarily, there will be increase in blood pressure, but this is not part of the Cushing reflex. Okay, increased blood volume is causing increased blood pressure. This is not Cushing reflex. This is a normal phenomenon. But whenever there is increased blood pressure, we know that here the baroreceptor will be stimulated, and whenever the baroreceptor is stimulated, what is going to happen? There will be decrease in heart rate, there will be decrease in stroke volume, and the blood pressure will be normalized. Okay, this is the response. So, in that sense, you can also say that increased blood volume is decreasing the heart rate. That can also be done by the baroreceptor. So, a patient presented with high blood volume accompanied by a decreased heart rate. If the question is framed like this, that increase in blood volume is causing bradycardia, which reflex is responsible for that, then you can say baroreceptor. Chemoreceptor is not going to give you this kind of response, because whenever there is increased blood volume, chemoreceptor is not going to be activated. So, chemoreceptor is not the answer. So, most probably this question, the options will be Cushing reflex is the best choice, okay, because increased blood pressure along with decreased heart rate, the Cushing reflex is the best suited for this, okay. But you have to look at what options are being given and then you have to look at the answer, okay. Chalo. Next one, decrease during spermatogenesis, hormone inhibiting FSH secretion is hormone inhibiting FSH secretion, okay, yes. So, always remember that during spermatogenesis, I will also show you one diagram also. There you will understand that two hormone, one is LH and one is FSH. So, this LH is inhibited by testosterone and this FSH is inhibited by your inhibin, and which inhibin you have already answered, inhibin B is the answer. So, always remember FSH is inhibited by inhibin both in case of male and in case of female, and in case of male the LH is inhibited by testosterone, in case of female the LH is inhibited by estrogen and progesterone, okay. So, that is the thing you have to remember, okay. Next one, which of the following component is absent in smooth muscle? So, previously we were discussing that which component is absent in smooth muscle, you have to remember couple of names. Like for example, I told you the T tubules is absent. Rather than T tubules, what is present in the smooth muscle? Caveoli is present in the smooth muscle, not in the skeletal and cardiac muscle. So, T tubules is absent. Second one which is absent, the Z line is also absent. Rather than Z line, smooth muscle mein the component which is present is known as the dense body, DENAC, dense body is present in smooth muscle. Are you understanding what I am writing? Okay. So, you have to remember all of them, you have to look at what is given in the question and then you have to choose the choices, okay. So, Z line is also absent, and the third one is troponin is also absent. Troponin is a calcium binding protein in skeletal muscle and cardiac muscle, but it is absent in smooth muscle. Rather than troponin, the calcium binding protein which is present in smooth muscle is known as the calmodulin, right. Calmodulin is present in smooth muscle. Along with that, nebulin is also absent in smooth muscle, as well as titin is also absent in smooth muscle. Corresponding molecule is not there in the smooth muscle. So, remember all these four are absent. 1, after that it is 2, 1, 2, 3, 4. Remember all 4 of them for your future MCQ. Nebulin and titin also absent in case of smooth muscle. So, T tubule, Z line, troponin and nebulin titin, all of them are absent in smooth muscle. Everybody got it? Okay. Give me a thumbs up whether you got it or not. ठीक है ना? Okay. Next question आ जाओ. Thank you. Okay. Oxygen sensitive channel in peripheral chemoreceptor permeable to which ion? So, peripheral chemoreceptor, where they are located? Peripheral chemoreceptor, where they are located? They are located at the level of the carotid bodies and aortic body. Carotid body and aortic body. The channel which is present there is the oxygen sensitive channel, and this channel is permeable to which ion? Potassium ion. So, you have to remember oxygen sensitive potassium channel is present in case of peripheral chemoreceptor. Okay, oxygen sensitive potassium channel. Whenever there is hypoxia, what will happen to this channel? The channel will get closed. That is why this is known as oxygen sensitive channel. Hypoxia will causes closure of this channel. Okay. Now, next question. Maximum water reabsorption occurs in which part of the renal tubule? Very simple question, but this question can be complicated. If the question is given like that, the maximum water reabsorption occurs in which part of the renal tubule in presence of ADH, and in absence of ADH. If this is the question, then also both the question will have same answer, that is proximal tubules. Proximal tubules, answer is Proximal tubule. Proximal tubule. Why? So, you are saying that in presence of ADH, now whenever the ADH is given in the question, na, students start thinking in a different way. They are not asking you that where is the site of action of ADH. This is not the question. They are asking maximum water reabsorption occurs in which part of the nephron in presence of ADH. ADH is there in the body, ADH is there in your blood. But ADH has action on which part of the nephron? The distal part, collecting duct and the distal part of the nephron. But that is not the question here. Even if the ADH is present, the maximum water is always reabsorbed in the proximal tubule, and how much percentage? 65 percentage, 65 percentage. So, whether the ADH is present or absent in your body or blood, proximal tubule water reabsorption is how much percentage? 65 percentage. Means, is ADH affecting the proximal tubular water reabsorption? Answer is no. ADH has no effect on proximal tubule water reabsorption, loop of Henle water reabsorption, no action of ADH is there. ADH, where it is acting? It is acting at the level of the collecting duct and the distal tubule. But if you have already absorbed 65% of the water from the proximal tubule, whatever water ADH is absorbing in the collecting duct, this is never going to be more than 65%, now getting my point? And it is saying that ADH can increases the water reabsorption up to 15 percentage. So, ADH, if the ADH is not there, water reabsorption in the collecting duct is only 2 percentage. If the ADH is present, then this 2 percentage will be increased to 15 percentage. But anyway, water absorption already has been done by the proximal tubule. How much percentage? That is 65 percentage. So, if the question is given in presence of ADH or in absence of ADH, maximum water कहाँ पे reabsorb होता है, where it is reabsorbed, always your answer is proximal tubule. Don't make any confusion. Getting my point? So, always it is 65% in the proximal tubule because ADH cannot affect water reabsorption in the proximal tubule. It is always 65%. If the question is where the ADH is increasing water reabsorption, then your answer is collecting duct. Then your answer is distal tubule collecting duct. Okay, but question is water reabsorption where it is maximum 65% proximal tubule. Okay, chalo. Hormone increases during the period of, answer batao, stress, starvation and deep sleep. These are the three stimulus that is given for the question. Okay. So, because you have read the previous year question, that is why I have kept this single liner. I have not given option because if the same question is given, two answer is possible. One is growth hormone, okay, and second one is the prolactin. Cortisol cannot be the answer here because this deep sleep is not a stimulus for cortisol. You are answering correctly that stress is a stimulus for cortisol. Starvation is a stimulus for cortisol. Okay, cortisol can be secreted by these two, but deep sleep is not a stimulus for cortisol. Cortisol का level maximum कब होता है? In the early morning, whenever you are awakening from the sleep. So that's why cortisol cannot be the answer. But if you look at the stimulus, growth hormone was given in your question, previous year question. But suppose growth hormone is not there, same question can be asked with a different option, and that is prolactin. Okay. Similar kind of stimulus is there for growth hormone and prolactin, but prolactin also has certain separate stimulus, that is estrogen, that is stimulation of the breast tissue in an near to the areolar region. If you stimulate the chest wall, breast tissue, all of them are the strong stimulus for prolactin secretion. Okay. And estrogen is also a strong stimulus for prolactin secretion, but some of the stimulus are similar between growth hormone and prolactin, and what are they? Stress, starvation, deep sleep, all of them are stimulus for prolactin and growth hormone both. So, remember both of them. Okay? Okay. Yes. So, this growth hormone is stimulated by non-REM sleep, and REM sleep is an inhibitor for the growth hormone. That is an additional information that you can remember. Okay. Next, what are the characteristic feature of primary hypothyroidism? So, I say like this, that primary, secondary, tertiary hypothyroidism. Okay, hypothyroidism means what is the basic thing? Basic thing is that T4 has to be decreased. So, primary means whenever I say primary, what is the problem? Problem is at the level of the thyroid gland. Problem is at the level of the thyroid gland. Okay. So, thyroid gland is destroyed, suppose like this. Okay. So, what will happen to the T4 secretion? Obviously, the T4 secretion is going to be reduced. But if the T4 secretion is reduced, what will happen? The TSH has to be increased because negative feedback will be lost, and what will happen to the TRH secretion? TRH secretion will also be increased. That is typical of the primary hypothyroidism. T4 decreases, TSH increases, TRH also increases. Okay. But whenever I say secondary hypothyroidism, then problem is at the level of the pituitary gland. Pituitary gland is problem, means which secretion will be decreased first? TSH secretion will be decreased first. Because the TSH is reduced, the T4 has to be reduced because stimulation is not there. But if the T4 is reduced, the negative feedback effect on TRH will be lost. So, in this cases the TRH will be increased. So, this is a typical feature of secondary hypothyroidism. And what about the tertiary hypothyroidism? Tertiary hypothyroidism means problem is at the level of the hypothalamus. If the hypothalamus is destroyed, think like this. Which hormone is going to be reduced first? TRH is going to be reduced first. If the TRH is reduced, do you think that TSH will be secreted normally? No. So, TSH has to be reduced. If the TSH is not there, what will happen to T4 secretion? T4 is also going to be reduced. So, all three hormones is reduced mean tertiary hypothyroidism. Okay. Only T4 is reduced, baki dono high, that is primary hypothyroidism. T4 and TSH both are reduced, but TRH is high, that is secondary hypothyroidism. Got it? So, please try to remember like this. Okay. Same for the hyperthyroidism also you can answer this question. Okay. Now, change in JVP in case of atrial fibrillation. We all know that in case of atrial fibrillation there will be absent in A wave in JVP. Absent A wave in JVP is the atrial fibrillation. Okay. Next question. Hormone responsible for the growth of the breast tissue in lactating mother. What is the answer? So, the best answer is prolactin. But apart from prolactin, estrogen, progesterone also has role. So, if you have to choose only one option, that hormone responsible for the growth of the breast tissue in lactating mother, prolactin is the main hormone. But you all know that during pregnancy, the development of the breast occurs mainly under the influence of estrogen, progesterone and prolactin, because during pregnancy, the estrogen level is also high, progesterone is also high, prolactin is also high. Okay. So, what the estrogen is doing? Estrogen is causing growth of the ductular tissue of the breast and the deposition of the fat in the breast. Progesterone is developing the alveolar system of the breast tissue, and prolactin is supporting both estrogen and progesterone. Without prolactin, estrogen, progesterone cannot act on the breast tissue like this. Okay. So, prolactin, estrogen, progesterone, all of them are causing development of the breast during pregnancy, but after pregnancy, you know, whenever the placenta is removed, the estrogen, progesterone is less. So, in case of lactating mother, whenever the mother is nursing the baby, the prolactin level increases to a very high level, and that prolactin is responsible for growth of the breast tissue even during the lactational period. So, the main answer of this question, that which hormone is mainly responsible for the development of the breast tissue during lactation is the prolactin. Okay. But during pregnancy, all three hormones are there: prolactin, estrogen, progesterone. Okay. Pregnant woman also, the prolactin has to be the answer. Okay. Because without prolactin, estrogen, progesterone cannot act. That is why I am talking about now. So, prolactin is also high during pregnancy, and that is developing the breast tissue. Okay. So, development of the breast is one of the function of the prolactin, that you know, and that is the main hormone. Even pregnancy also, this is the answer. Yes. Okay. So, they can show you this ductular tissue, you have to remember separately, estrogen for ductular tissue and progesterone for alveolar system. Okay. Now, the important one-liner has been done. Now, we are going to the important images. So, images discussion means without action potential diagram, nothing is possible. So, action potential diagram, you have to remember certain phases. Okay. So, first part of this action potential. Okay. So, suppose this is a neuronal action potential. So, neuron action potential means what is the RMP? RMP is minus 70 millivolt, that we have already discussed. So, from this minus 70 millivolt, whenever the membrane voltage is reaching up to this minus 55 millivolt. Okay. So, this is minus 55 millivolt. This part of the potential change is known as the local potential. So, here you have to remember this is known as the local potential. Okay. So, local potential is not part of the action potential, but whenever local potential is crossing this threshold voltage of minus 55 millivolt, this is the threshold voltage. Whenever you are crossing this threshold voltage, then the action potential will start, and the first part of the action potential, this is known as the depolarization phase of action potential. It is due to entry of sodium. Downward direction arrow means this is entry to the cell, sodium. Okay. And the remaining part of the action potential is known as the repolarization part of the action potential. So, this repolarization phase of action potential is due to exit of potassium from the cell. Outward arrow means exit of potassium from the cell, and the part of the action potential which is below this threshold voltage, below this RMP, this is known as the after hyperpolarization. After hyperpolarization is also due to efflux of potassium or exit of potassium from the cell. Okay, right. So, at least you remember that the depolarization is due to influx of sodium influx. Which kind of sodium influx? This is due to the voltage gated sodium channel Na dot V, and repolarization is due to efflux of potassium ion through the voltage gated potassium channel. Yes, potassium channel is very slow to closed, that is why the after hyperpolarization phase occurs. Okay, you know this thing. Okay. Now, next thing is one of the MCQ directly taken from your FMGE exam. So, we have already discussed this part. Okay. So, in the following left ventricular pressure volume loop diagram, point C. So, here you have to remember that A to B, this is the filling phase of the ventricle, B to C, this is the isovolumic contraction phase of the ventricle, then C to D, this is the ejection phase of ventricle, and D to A, this is the isovolumic relaxation. So, you have to remember this is ejection phase of ventricle, this is isovolumic contraction phase of ventricle, this is isovolumic relaxation phase of ventricle, and this is filling phase of ventricle. This is in brief the PV loop. So, question is at point number C. So, point number C is I can find out here. So, point number C is the starting point of the ejection. Ejection means left ventricle is ejecting blood in the arch of aorta. Which valves you have to open up? Opening up of aortic valve is required for the ejection to start. And at point number D, this aortic valve is going to be closure. So, closure of the aortic valve is going to happen here. Okay. Then at point number A means this is the starting point of the filling phase of the ventricle. So, ventricular filling means which valves you have to open up? You have to open up the mitral valves, mitral opening. Okay. And for right ventricle, obviously tricuspid opening. And point number B, this is the first heart sound point. So, this is the closure of the mitral valves. Very good, all of you know this thing. So, point number C is the opening up of the aortic valves. So, answer is the option number B is easy for you. Okay. Chalo. Now, I told you already that I am going to show you the Uyghur's diagram. So, this Uyghur's diagram, 2-3 things you have to remember here. So, the cardiac cycle different phases has been shown in this diagram. See here that isovolumic contraction. So, this same pressure volume loop here, the same pressure volume loop where you are finding out this isovolumic contraction. Okay. Then ejection, then isovolumic relaxation, the filling phase, all these phases has been plotted, but here the plotting is little bit different. X axis is the time and y axis is the pressure. Pressure volume loop, x axis was volume and y axis was pressure. That is why the loop, pressure volume loop that we have discussed, that was different shape, but here x axis is the time and y axis is the pressure. Okay. So, during this pressure volume loop, these two things, this is the aortic pressure and this is the ventricular pressure, solid line, ये दोनों को छोड़ दो, बाकी जो है everything is your MCQ. What is that? First of all, I will show you one curve. This curve is the JVP curve. So, this is the pink color line. This is basically change of pressure in the atrium. For left atrium, it is not the JVP, but similar kind of graph will be seen in case of right atrium also. So, you can imagine that this is a kind of JVP for right atrium. JVP if you plot this kind of plot in case of right side. Okay. Now, next just below this JVP diagram, if you look carefully, you are getting this ECG, phonocardiogram. So, this diagram, this is the recording of the heart sound. Recording of the heart sound is done by an equipment which is known as phonocardiogram. So, this is the phonocardiogram recording of the heart sound. Okay. And below that you are getting the recording of the ECG. So, P, Q, R, S. Okay. At least you would remember these three diagram from the Uyghur's diagram. Baki cheez you may not. Now, you look at, if I ask you that in JVP and heart sound, दोनों को correlate करो, JVP and heart sound, which heart sound correspond with which part of the JVP, which wave of the JVP. So, very easy to remember, JVP A wave, this is the A wave in the JVP. So, I will write down, this is the A wave in the JVP, this is the C wave, this is the V wave, this is the X and this is the Y descent. Okay. Now, A wave in the JVP means atrium contraction responsible for a heart sound, that is the fourth heart sound if it is present. So, with this A wave in JVP here, the small heart sound which you are getting here, this is the S4. Okay, so try to remember that A wave in the JVP. So, JVP, A wave in the JVP is the fourth heart sound. Then you can easily see here there is a big heart sound, loud heart sound which is corresponding with this C wave. Okay, this dichrotic notch followed by this C wave. So, basically this notch along with the C wave, this is the closure of the valves, that is isovolemic contraction, which valve is getting open, aortic valve, which valve is getting closed, mitral valve. So, because of the closure of this mitral valve, this heart sound is happening. So, mitral valve closure is giving which heart sound? That is the first heart sound. Obviously, the first heart sound after the fourth first heart sound is going to happen. Okay. Then you can look at here, this is the S2. S2 is appearing just before the V wave. Okay. So, V wave के साथ the heart sound which is corresponding, that is the second heart sound. Just before the V wave peak, the second heart sound is happening. And the third heart sound after the V wave. So, after the V wave, the third heart sound is also happening, but this is after V wave peak. Getting my point? So, we try to remember this. So, A wave produce the fourth heart sound, okay, A wave in the JVP, C wave correspond with the first heart sound, and V wave second and third both, but before the peak of the V wave, the second heart sound will appear, and after the peak of the second heart sound, the third heart sound is going to appear. Remember? Okay. Now, coming to the ECG and heart sound. ECG and heart sound, which ECG wave correspond with which heart sound? So, I am writing here ECG. Okay. So, look at here, the first heart sound, this is the first sound I told you, it is corresponding with which wave in the ECG? The R wave. So, first heart sound correspond with which wave in the ECG? R wave in the ECG. Okay. Second heart sound, it is here. So, second heart sound correspond with the T wave ending, right. The third heart sound and the fourth heart sound correspond with the P wave, in the ECG, ending of the P wave, and the third heart sound correspond with the ST segment of the ECG. ST segment of the ECG is the TP segment, not the ST segment, the TP segment of the ECG. TP segment of the ECG. Getting my point? So, these are the things that you have to remember. Third heart sound correspond with the TP segment, fourth heart sound correspond with the P wave in the ECG, and first heart sound R wave, second heart sound end up T wave. This is the thing that you have to remember, okay, from the Uyghur's diagram at least, because these are the questions which they are giving frequently in MCQ. So, try to remember like this. Am I clear? Okay, chalo, next. Next, from this diagram, identify the movement from the following picture. So, this is very easy, as you can see here in this diagram, that this is the location of the food bolus. So, the food bolus where it is located, just proximal to that part there is a contraction of the GIT, and just distal to that part there is relaxation of the GIT. So, this is typical of which movement? This is typical of peristalsis movement. We all know that peristalsis is a kind of propulsive movement where contraction of the proximal part of the food bolus occurs due to ACH and the substance P, okay, and the relaxation of the distal parts occur due to nitric oxide as well as the VIP, vasoactive intestinal polypeptide. Okay. So, peristalsis is the typical answer, but sometimes the image based question can also be given up for segmentation and the migratory motor complex movement. So, in segmentation what you have to look at this diagram carefully. So, this is the location of the food bolus. Okay. So, initially the food bolus is located here, then because of the contraction the food bolus has been fragmented into two parts, one part is going here and another part is going there, and again the food bolus is coming in the form. So, food bolus is moving away from one another, and then again the food bolus is coming close to one another. So, as if the food bolus is moving like a pendulum, the food bolus is moving like a pendulum, this kind of pendulous movement. Okay. Food bolus is moving like a pendulum, or pendulous movement of the food bolus is typical of segmentation movement of the intestine. So, segmentation movement and peristaltic movement, both of the movement occurs when the food is there in the GIT, means they are known as the fed state motility. Fed state motility when the food is there in the GIT. Okay. Segmentation, peristalsis, but which one is the dominant one? Segmentation is the dominant motility when the food is there in the intestine. But when the food is not there in the GIT, one kind of fasting motility occurs in the GIT. So, this is an MCQ, fasting motility in GIT, and that is what? Migratory motor complex. So, migratory motor complex is a motility which occurs when there is no food in the GIT for the last 90 minutes, at least 90-minute fasting is required. Okay. And the motility will start from mid part of the stomach up to the level of the terminal ileum. What I told, mid portion of the stomach to terminal ileum. So, suppose our diagram is given, and in the diagram you are seeing a diagram like this, you are not understanding anything, and here it is written that this is the part of the duodenum, this is the part of the jejunum, and this is the part of the ileum, and this kind of diagram is given. So, this is not a kind of mechanical motility. This recording which has been given here, this is the electrical activity of the intestinal smooth muscle. So, this kind of diagram means increased electrical activity, means intestine is getting contracted, and this kind of flat line means no activity. So, what you are finding out, activity has been started from the part of the duodenum which is causing contraction of the duodenum. After a little bit of time, after some point of time, this activity is also seen in the jejunum, and then this activity is also seen in the ileum. So, what is the meaning of this line? Meaning of this line is that this same activity which was started at the level of duodenum, it is going towards the jejunum, and then it is going towards the ileum, but with time interval. See, if this is the time point where the activity has been started in the duodenum, I can easily understand that if this is the starting point, it is happening in the jejunum a little bit later after the duodenum, and it is happening in the terminal ileum further delay, after some further time delay, that is happening in the ileum. That means the same activity which has started in the duodenum, it is going towards ileum followed by it is going to the jejunum followed by it is going to the ileum. So, this is a kind of sweeping motility which has been started from the mid part of the stomach or duodenum, and then it is going towards the terminal ileum. This motility is typical of migratory motor complex. Okay. And there will be a silent period in between two migratory motor complex. The interval between these two silent period is again 90 to 120 minutes. So, interval between these two migratory motor complex is 90 to 120 minutes. Means if there is one migratory motor complex which is moving from duodenum towards ileum, suppose this is 1 mmC, the second mmC will start after 90 to 120 minute interval. Okay. So, migratory motor complex is a very slow movement, yes, as you told. Okay. So, migratory motor complex, please do not mind, I am this session at least 15 to 20 minutes more is required. Okay. Okay. So, it will reappear at an interval of 90 to 120 minutes. Okay. So, this is all about the migratory motor complex. Okay. Next question, a patient presented with symptoms as shown in the image below. Okay. So, this is a repeat question, all of you know that A is the site of lesion. So, this is the site of lesion. Because of the site of lesion in the half of the spinal cord, what you are finding out, there is loss of proprioception, okay, vibration, discrimination, means this is the loss of sensation of dorsal column. So, dorsal column sensation is lost on the same side, and the pain temperature and other senses, and pain temperature is lost on the contralateral side. So, this is transmitted by anterolateral spinothalamic tract. So, the anterolateral spinothalamic tract is damaged on the opposite side of the body, and dorsal column is damaged on the same side of the body. This is due to hemisection of the spinal cord, and all of you know that this is Brown-Séquard syndrome. The other syndrome that is given, Dejerin-Roussy syndrome. This is known as the thalamic pain syndrome. The common name for this disorder is thalamic pain syndrome. Okay, thalamic pain syndrome. So, severe pain, agonizing kind of pain throughout the body because of the infraction, because of the damage in the small part of the thalamus is Dejerin-Roussy syndrome or thalamic pain syndrome. Other syndrome that has been given in the choices, Weber's and Weilenberg syndrome. I have written about the Weber's and the Weilenberg syndrome. Important thing that you have to remember here I have highlighted. So, read this thing later on if you want to remember a little more information about these two syndrome. Okay. So, this is all about the Brown-Séquard syndrome. Now, the next question is a diagram which is a cystometrogram. So, all of you know that in case of urinary bladder, when the urine is filled inside the urinary bladder, if you measure the pressure change within the urinary bladder, you are going to get certain curve. Okay. So, first one is the 1A. Look at this diagram, 1A part. So, 1A means initially slight increase in pressure. Okay. So, look at here what is written. So, 1A portion means initially slight rise in pressure when the first increment of the volume is produced, that is the 1A. 1A के बाद the next portion is a flat portion, that is 1B, and this is the main portion where the question is being asked. So, 1B means a long flat segment where no further increment of pressure is produced, although the urinary bladder is filled with urine, but pressure is not increasing. Why? Because whenever the urine is coming to the urinary bladder, it is proportionally stretched and the pressure is not rise much. This is because of a important property of the smooth muscle. That property is known as the plasticity property of the smooth muscle. So, if you stretch the smooth muscle will stretch and it will change its shape. So, whenever the urine is filling inside the urinary bladder during this 1B portion, the plasticity property of the smooth muscle is absorbing the pressure. That is why the pressure rises not much. Also, there will be application of the Laplace law during this part. Okay, there will be increase in tension in the bladder, but pressure is not going to change. So, please remember that answer of this question is obviously the plasticity property of the urinary bladder, but also Laplace law is applied during this part of the 1B portion. Okay, Laplace law and the plasticity property, both are the answer of this 1B. And then at the end of the 1B, when the urinary bladder is filled with approximately 400 ml of urine, now you cannot hold your urine further. So, now the urinary bladder will contract suddenly, and that is the onset of the micturition reflex. Whenever the micturition reflex is happening, suddenly there will be increase in pressure in the urinary bladder. So, that is why it is written segment 2 is onset of the micturition reflex, which is rising the pressure in the urinary bladder suddenly. Okay. So, at least you remember this bare minimum information about cystometrogram. Okay. Next one, we have already discussed this thing. If you look at this diagram carefully, so the same information which you know from there, the question has been asked. So, what you are finding out here, this is the Leydig cell. So, what is the product of the Leydig cell? We all know that the Leydig cell is going to produce testosterone. Testosterone, okay, is going to inhibit the which hormone? The LH hormone. And then you can find out here on the other half side, there is Sertoli cell. Okay, Sertoli cell is giving a negative feedback on FSH, and what is that one? That is the inhibin B. Okay. So, obviously the A is the testosterone and B is the inhibin. So, this B is going to be the answer of this question. Okay. A is not the inhibin, A is the testosterone. So, basically what you have to remember is this one, that please look at this. This is known as the hypothalamo-pituitary gonadal axis. So, hypothalamus is producing GnRH, that is a gonadotropin releasing hormone. So, there will be pulsatile secretion of the gonadotropin releasing hormone, which act on the anterior pituitary, which is producing FSH and LH. FSH is acting on the Sertoli cell. So, FSH has a receptor on Sertoli cell, very important diagram, and Sertoli cell is responsible for spermatogenesis. It gives nutrition to the developing sperm, but spermatogenesis is happening under the influence of Sertoli cell, but which hormone is essential? Testosterone is also required for spermatogenesis, but that testosterone is produced by the Leydig cell. So, the Leydig cell will produce testosterone, testosterone will reach close to the Sertoli cell and it is helpful for the spermatogenesis. Apart from that, Sertoli cell also produces inhibin B particularly, and that inhibin B gives negative feedback on which hormone? So, say this is on FSH. So, inhibin giving negative feedback on FSH. Similarly, this testosterone also has some negative feedback, but that negative feedback is for which hormone? That is for LH. So, please remember this very important thing. Okay. Okay. Next, the mathematical problem. Okay. So, mathematical problem, only 2 problem that has been given in your FMGE exam so far is based on this Huygens-Poiseuille's law or Poiseuille-Huygens formula. This is very simple formula. According to this Huygens-Poiseuille's equation, all of you know that the resistance of any part, this is the formula 8 NL pi r to the power 4. So, this is eta, 8, number 8, eta L. So, this eta is, all of you know, this is eta is the viscosity. Okay. So, this eta, then length pi r to the power 4. So, r is the radius, but you do not have to remember all of them, because you know you have to only remember that this resistance is changing with the radius to the power 4. Okay. At least you remember this important information, that the radius is changing, resistance is changing with radius to the power 4. So, now if you look at the question, yes, very good, all of you have given correct answer. Radius or diameter, whatever you say, it is reduced to 1/3. So, whenever you are getting this number 1/3, just make it to the power 4. So, that means it is 81. So, how much resistance is going to increase? So, there will be increased in resistance, that is 81 times than that of normal. Getting my point? Very simple. Just remember this formula, resistance is inversely proportionate to the radius to the power 4. Okay. So, this is one question that has been asked in your FMGE exam. Second, based on the same formula, they are asking you to calculate the blood flow. So, here I told you that, remember like this, we remember that the V is equal to IR, Ohm's law we remember, V is equal to IR. So, I is the flow. So, I is basically inverse of resistance. Okay. So, if you can calculate this resistance by the Huygens-Poiseuille's law, then you can easily comment on this blood flow or I, that will be inverse of the resistance. Okay. So, now here the radius of the vessel is double. So, radius has been increased, there is vasodilation, radius of the blood vessel is double. So, what will happen? Resistance will decrease. How much resistance is going to decrease? 2 to the power 4, it is double. So, it is twice than that of the normal radius. So, to the power 4 means 16 times blood flow is going to increase, flow is going to increase 16 times, very simple thing. Okay. These two already has been asked in your FMGE examination, but now you try to remember this also, calculation of the filtration pressure. It has been asked multiple times in NEET, but so far has not been asked in FMGE exam, but it can be given. So, whenever you are getting calculation of the filtration pressure at the level of the capillary or glomerular capillary, both is based on the same principle, that is the Stirling force. So, in Stirling force, all of you know this thing, that if I have to calculate the net force from the capillary towards this tissue direction, if I want to calculate the net force, I can understand that this capillary hydrostatic pressure, that is known as the hydrostatic pressure of the capillary PC. It is opposed by interstitial fluid pressure, that is PT, tissue pressure. Okay. So, this is PC, this is PT, getting my point? And then if I look at this oncotic pressure, plasma colloidal oncotic pressure, so it is denoted by pi. So, suppose this is pi C and this is pi T. So, I want to calculate the force which is directed from capillary towards the tissue. So, which force is helpful? Oncotic pressure. So, I will write down like this, pi T minus pi C is opposing this. If I add these two forces, this is the calculation of the net force from capillary towards the interstitial tissue. This is the net force from capillary towards the interstitial tissue, and this formula was first proposed by Stirling. That is why this is known as the Stirling force. Okay. Now, based on this same force, you can calculate the net force for filtration at the level of the capillary or at the level of the glomerular capillary, both as the same formula. So, based on this question has been given. So, here the capillary hydrostatic pressure, that is the PC, tissue hydrostatic pressure, that is the PT, colloidal oncotic osmotic pressure, that is the pi C, and tissue oncotic pressure, that is the pi T. So, I told you already the formula. So, the net force is equal to PC minus PT, okay, plus pi T minus pi C. This is the formula. So, if I put all of this value, so this is 30 minus 2 plus pi T is 2 minus 25. So, 23, 25, this is equal to 5 millimeter of mercury is the net force. Got it? So, this way you have to calculate if the question is given. Okay? Okay, remember, important for future MCQ. Next one. Calculate the cardiac output based on this. Again, this is a very simple, and this is a question which has been asked in NEET PG multiple times. So, this is based on Fick's law, Fick's principles, basically I should say principle. Okay. Fick's law is for simple division, Fick's principle. So, Fick's principle is saying the cardiac output is equal to oxygen consumption, okay, upon arterial oxygen minus venous oxygen, artery minus venous oxygen. This is the simple formula that you have to remember, oxygen consumption upon your artery minus venous oxygen. So, oxygen consumption is directly given here is 240 ml, 240 ml. But look at arterial oxygen and venous oxygen, they has been given in 20 ml percentage. 20 ml percentage means 20 ml per deciliter of blood, 20 ml per 100 ml of blood. So, 20 ml oxygen is present in 100 ml of blood. If I convert it into per ml, because the oxygen consumption is given in ml, so I have to convert this oxygen into per ml. So, 20 ml oxygen is present per 100 ml of blood. Okay. So, it will be equal to 0.2 ml per ml of blood. Same way, if I convert this, if I convert this into, this will be equal to 0.15 ml of oxygen per ml of blood. So, now I am going to put this into the equation. So, upon 0.2 arterial oxygen minus venous oxygen is 0.15. Okay. So, now this is basically 240 upon 0.05. So, if you do this, I think 4800 होगा, 4800 ml होगा, देख लेना इसको. Okay. So, this is the answer of this question, cardiac output by Fick's principle. All of you got it? Everybody? Tell me whether you get it or not. So, this is the 4.8 liter or 4800 ml. ठीक है. So, I have converted everything into ml. So, my answer will be in ml. So, उसको liter में convert कर लो तो ये आपका answer होगा. Very good. All of you. Great. Okay. Now, the last part of this session, that is the important table. 2-3 important tables I will show you. Try to mug up the information, the important information from those table. Okay. So, first table is the GLUT and SGLT table. Although this is very simple, but sometimes we do mistake. So, that is why I have kept this table in your in this LRR session. So, SGLT1 and SGLT2 very important where they are located. SGLT1 and 2 both are present in the kidney, but if I ask you which SGLT is mainly responsible for glucose absorption in the kidney, SGLT2 But if the question is which SGLT is present in intestine for glucose reabsorption, only one answer is possible, that is SGLT1. So, kidney contain both SGLT1 and SGLT2, but main is SGLT2. In the intestine, only one SGLT, that is SGLT1. Okay, right. Next one is the GLUT1. Mainly it is present in the RBC. Never forget this. Blood-brain barrier. Never forget. Okay. GLUT2, beta cell of the pancreas. Sometimes we do mistake that if the question is which GLUT is responsible for entry of glucose in the pancreatic cell for secretion of insulin, that is GLUT2. But if the question is insulin act on which GLUT, that is insulin responsive GLUT, that is your GLUT4 that we have already discussed. So, insulin responsive GLUT means this is the GLUT which is stimulated by insulin. But if the question is which GLUT is responsible for secretion of insulin at the beta cell of the pancreas, then your answer is GLUT2, because GLUT2 is present in the beta cell of pancreas through which glucose enter in the pancreatic beta cell and insulin secretion occur. Okay. So, this small thing you have to remember from this table. Okay. Next table, CVS hemodynamic related table. Sometimes I have seen direct question has been given from this table, like for example, which organ has highest blood flow? According to Genong, it is the liver. Okay. But whenever the question is which organ has highest blood flow per 100 gram of tissue per minute, per 100 gram of tissue, then your answer is kidney has the highest blood flow per 100 gram of tissue or per gram of tissue. Total blood flow is maximum in the liver, but per gram of tissue means huge amount of blood is concentrated in which organ? Your kidney is the answer. Next, look at here, oxygen consumption. If the question is oxygen consumption is maximum in which organ, total oxygen consumption they are talking about, then look at here, again the liver. If the liver is not there, your answer will be the skeletal muscle. But see, whenever the question is per 100 gram of tissue, which organ is consuming highest oxygen? This has been asked in MCQ already. Now your answer ho gaya heart. Getting my point? So, please remember total ek answer, that is the ml per minute, and per gram or per 100 gram, same answer, that is given in this table. So, per 100 gram of tissue is heart is the answer, and per 100 gram of tissue blood flow is maximum in kidney. Same way, artery venous oxygen difference is highest. Artery venous oxygen difference means which organ is consuming huge amount of oxygen from artery. That is why if you take the artery venous oxygen difference, that is maximum in which organ? Again your answer is heart. So, this way you have to read this table, some important line from here. Okay. Next one, nerve fiber classification. So, all of you know this classification is very important, that they have directly asked you that proprioceptive fiber are which kind of fiber, A alpha type of fiber, whether they are myelinated or not. So, all of you know that this A fiber and B fiber, they are the myelinated kind of fiber. So, please remember A and B are myelinated, C fiber is unmyelinated, and A fiber has the highest conduction velocity A alpha, and conduction velocity is decreasing towards the C fiber. Along with that, you must have to remember that pain and temperature is carried by which fiber. So, A delta is also for temperature, okay, but look at here temperature, if the temperature is warm, then it is the C fiber, it is the C fiber, but if the temperature is cold temperature, then it is the A delta fiber, okay, it is the A delta fiber RAR, okay. And then pain. Pain is also carried by A delta and C fiber, but there is a difference. The A delta fiber mediated pain is the fast pain, and C fiber mediated pain is the slow pain. Very good. Okay. So, this table classification of nerve fiber is also important, and this is all about LRR. Okay. So, I believe so this is the bare minimum thing, basic minimum thing which you must revise before going for your exam from physiology. Okay. So, I believe right shift, left shift multiple times we have discussed in multiple session. So, right shift means remember like this, increased temperature is a cause of right shift. Now, if there is increase in body temperature, okay, if there is increase in body temperature, what will happen? There will be increase in metabolism. Increased metabolism means there will be increased production of carbon dioxide. Increased production of carbon dioxide means there is acidosis, or along with that increased 2,3 DPG, all of them are going to causes right shift of the oxygen hemoglobin dissociation curve. and left shift means reverse of this is left shift, but along with that you have to remember that fetal blood is also left shift, carbon monoxide poisoning is also left shift, along with that storage of blood. So, fetal blood, storing of the blood, carbon monoxide poisoning and myoglobin, these four things they also causes left shift of the oxygen hemoglobin dissociation curve. So, increased temperature, increased carbon dioxide, increased H plus ion, increased 2,3-DPG, these are the causes of the right shift of the oxygen hemoglobin dissociation curve, right. Okay. So, this is all for today. Matlab, if you reverse this thing there will be low left shift, but along with that I told you separately you have to remember there are certain cause which causes left shift not because of decrease, like fetal hemoglobin, that is an inherent cause of left shift. Storage of blood, inherent cause of left shift because of the decrease in 2,3-DPG. Okay. Myoglobin, okay, the curve is rectangular hyperabolic which looks like a left shift of the curve, and carbon monoxide poisoning which also causes left shift of the curve. Along with that, if there is decrease in temperature, decrease carbon dioxide, decrease H plus ion, decrease 2,3-DPG, also there will be left shift. Okay. So, this is the basic thing that you have to remember. So, this is all for today. Thank you so much. I believe you will get the PDF. So, download the PDF, revise it once again and go to your exam. Okay. So, best of luck. Bye bye. Take care.